Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about trauma, which can lead to long-term issues. This topic is quite hard to talk about because it's often misunderstood in the community. With me today, I have Dr. Lynette Hillsberg who will talk about this. Welcome, Lynette, and thanks for chatting.
Thanks, James. It's a pleasure to be here.
This is an interesting topic. Trauma happens to most people, and for the majority they're okay. Isn't it only the ones that can't cope with this that have the problems?
Well, that's a common thought. Unless it's happened to you, it's really hard to understand. Long-term trauma is called post-traumatic stress disorder or PTSD. This happens once the initial acute phase of trauma has been processed.
What do you mean by acute phase?
Well, there are two phases of trauma. The first is called the acute phase or acute stress disorder. That's ASD, and that lasts for around 4 to 6 weeks. It's when someone's exposed to an extreme trauma. Example is witnessing or being involved or learning about an event, a serious accident or death, either for themselves or others.
So what happens to the person?
Well, they may experience difficulty concentrating, feel detached from their body, experience the world as unreal or dreamlike. They feel numb, increasing difficulty recalling specific details of the traumatic event, and it's called dissociative amnesia.
Is there anything else?
Yeah, the person can develop severe anxiety due to flashbacks and reliving this event. Because of this, they avoid anything to do with what happened, have reduced emotional responses, can find it impossible to experience pleasure in everyday activities, have poor sleep, hypervigilance, and frequently feel guilty about being alive. They can also have feelings of intense fear, helplessness, or horror.
And how long does this last for?
Well, the person can have these symptoms during the first 4 weeks after the trauma. And they're not usually caused by pre-existing medical problems like drugs, alcohol, or psychotic issues.
Wow, I didn't know that. So what is the difference between ASD and PTSD then?
Okay, so ASD symptoms may start within 1 month of the trauma and usually goes away once the person is able to process what's happened. The person doesn't seek help or resolve the trauma. This can lead to PTSD, and sometimes the symptoms may be hidden or don't appear until years after the event. And when they do appear, these symptoms can cause significant problems in the social work or relationships, and they also can interfere in the ability to go about your normal daily activities or tasks.
So, what are the symptoms?
Okay, PTSD symptoms are generally grouped into 4 types: intrusive memories, stressful memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Symptoms can vary over time depending from person to person, and it's their resilience to deal with these as well as what triggers these memories.
Okay, do you have some examples?
So with intrusive memories, this may involve recurrent, unwanted, distressing memories of the trauma where the person relives the event as if it were happening again and again, and this is called flashbacks. And when they're sleeping, they may have upsetting dreams or nightmares about the event or even remembering the trauma. And they can experience severe emotional distress or physical reactions. The next one is avoidance, and this is where the person tries to avoid thinking or talking about what happened. They also avoid going to places or do activities or meet people that remind them of the traumatic event. And this can lead to negative changes in thinking or mood.
What do you mean by negative changes in thinking and mood?
Well, this is where you can experience negative thoughts about yourself, other people, the world, feelings of hopelessness for the future, and memory problems, and that includes not remembering important aspects of the traumatic event. The difficulty maintaining close relationships, and that's feeling detached from family and friends, lacking interest in activities that you really once enjoyed, difficulty experiencing positive emotions, feeling emotionally numb, and changes in physical and emotional reactions.
What are some of the physical changes? Does this mean you put on weight?
No, it's changes in physical and emotional reactions are called arousal symptoms, and this may include being easily startled or frightened, always being on guard for danger, self-destructive behaviour such as like drinking too much or driving too fast. There's trouble sleeping, trouble concentrating, being irritable with angry outbursts or even sometimes aggressive behaviour, and having the feeling of overwhelming guilt or shame.
I have to ask this as I have children. What happens to them? I mean, how do they react to trauma?
Well, children process trauma differently than adults as they don't have the schooling, the resilience or even the life experience that we have. Most children use simple words to explain or drawings to show how they're feeling. For children 6 years or younger, they don't have language skills, so they may reenact the traumatic event or aspects of the trauma through play, or they may experience frightening dreams that may not include aspects of the trauma, and these can be quite intense. Often, they may not be able to explain the feelings, but they just know they had a scary dream.
You talk about intensity. Can you explain a bit more about this?
Well, for adults, PTSD symptoms can vary in intensity over time, and these can increase when you're feeling run down or stressed in general, or when you come across reminders of actually what you went through. For example, you may hear a car backfire and relive combat experience. You might read a book or an article that describes a similar situation that you went through. You might see something on the news about maybe sexual assault and feel overcome by memories of your own assault.
So why do some people get PTSD and others don't? Is one person more at risk than another?
Yeah, doctors aren't sure why some people get PTSD. As with most mental health problems, people of all ages can have post-traumatic stress disorder. However, some factors may make you more likely to develop this after a traumatic event, such as stressful experiences, including the amount and severity of trauma that you've gone through in your life, experienced trauma earlier in life, such as childhood abuse, features of your personality, so often called your temperament, the way our brain regulates the chemicals and hormones. This is where your body releases in response to stress. Having a job that increases your risk of being exposed to traumatic events. So this could be police, first responders, or military. Having other mental health problems such as anxiety or depression. Having problems with substance misuse such as excess in drinking or drug use. Lacking a good support system of family and friends. And having blood relatives with mental health problems, including anxiety and depression.
So, what kind of traumatic events can lead to this?
Well, the most common events leading to the development of PTSD include working in a job where trauma happens every day. For example, police, hospital emergency, first responders, and combat exposure. The childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, being involved in a serious accident.
That's a lot. Are there any others?
Yeah, there are many other traumatic events that can lead to PTSD, such as fire, natural disaster, mugging, robbery, plane crash, torture, kidnapping, rape, life-threatening medical diagnosis, terrorist attack and other extreme or life-threatening events.
So, long term, what happens?
PTSD can disrupt your whole life, your job, relationships, health, and your enjoyment of everyday activities. It may also increase your risk of other mental health problems, such as depression and anxiety, issues with drugs or alcohol, eating disorders, suicide thoughts and actions.
So, how can I prevent this from happening if I experience trauma?
Well, that's a great question. To help prevent PTSD, it's advisable to seek out help and support straight away and to prevent normal stress reactions from getting worse and developing into PTSD.
So, what help do I need to find?
Well, this may mean turning to family and friends who will listen and offer comfort. It may mean seeking out a mental health professional for a brief course of therapy to help with the processing of events and working through your emotions and your reactions. Some people find it helpful to turn to their faith or their community. Support from others may help prevent the person turning to unhealthy coping mechanisms. That's like using alcohol or drugs.
You've given a lot of information. We're nearly out of time. So what do you feel is the most important thing to remember if you're exposed to trauma?
After surviving a traumatic event, many people will have PTSD, and these symptoms are where they are unable to stop thinking about what's happened. This acute phase can include feelings of fear, anxiety, anger, depression, guilt. And these are normal common reactions to trauma. However, it's important to remember and understand that majority of people exposed do not develop long-term PTSD. If you seek help straight away, it will help you process the trauma that you've experienced.
Well, thank you, Lynette. That's all we have time for today. Thanks for chatting and explaining this interesting topic.
You're welcome, James. It's been lovely to talk with you, and I look forward to chatting with you in the future.